Today we got a progress report on how the Department of Veterans Affairs is trying to end complaints about long wait times and inadequate care at its clinics and hospitals across the mid-state. The VA says they have made some progress, but there's still a long way to go. News Channel 5's Jason Lamb joins us from the smart screen to show us. Jason.
Well, that's right, Vicki. To show improvement for veterans who need medical care, they pointed to their electronic waiting list for people who need an appointment. Last year in the Tennessee Valley region, it was more than 4,500 patients long at this time. But this year, July 2015, it's down to just less than 600 people. And how about for the people who work there? Last year, the employee turnover rate was almost 10% in 2014. Now it's down to about 5.9%. Big changes, and they say there are more to come.
Okay, good morning and welcome.
The head of the Department of Veterans Affairs Tennessee Valley Healthcare System faced TV cameras and reporters today after facing complaints that Tennessee's VA clinics and hospitals aren't doing enough for veterans who need medical care.
We're moving ahead and there's a lot of improvements moving forward.
Among those improvements, the VA says they've already hired 214 new positions over the past year, both clinical and administrative staff, to help deal with the backlogs and wait times, some more than 30 days long.
That's been a big positive so the clinicians and especially the staff, the clinical staff that's taking care of the patients, have the support staff that is needed.
The VA says they'll be expanding several of their buildings in Middle Tennessee, including a new community-based outpatient clinic in Sumner County expected to open late next year. The VA says they specifically pushed for hiring in certain specialties, like ophthalmology, where getting qualified staff is tough.
There were some specialty areas that we had some difficulty recruiting, and because of the different incentives and the things that we've been able to do, we've been able to recruit in those areas.
The director said today there's still a long way to go in making changes, like converting the VA Urgent Care Center in Murfreesboro back to an emergency department once they hire more staff. He says it's just one step toward the overall goal of better care for veterans.
We've made a lot of progress, but we still have a lot of work to do.
Now, the VA says it met with veterans focus groups and conducted town hall meetings to come up with their action plan. Back to you.
Thanks,